future.
The money follows the patient. I understand its advocates over here call it patient-focused funding. The overall result has been a mess. The new system was supposed to introduce what the economists call new financial disciplines. Well, it didn't work out that way. In its first year, the National Health Service actually overspent its budget for the first time in 60 years, which doesn't sound like financial discipline to me.
We do have some really heated issues here, some very emotional issues.
My grandmother is 93 years old, okay? I'm here because I like the fact that I have the nurses to back me in the information that I have been given. And when I sit out and I see my 93-year-old grandmother that has been in Kamloops for 80 years and has paid her dues, paid her taxes, paid into the healthcare system, and as she's being moved around from nursing home to nursing home, you guys are going to bloody well kill her before she's happy dying where she wants to be. And I want the fact that the nurses are backing me in my information.
We've heard a lot about this demographic time bomb, the impact of an aging population. The fact of the matter is that while aging does put some pressure on the healthcare system, it's perfectly sustainable. The impact is about 1% a year on healthcare spending. And according to our calculations, all we really need to do is maintain an increase in healthcare spending of a little less than 5% a year, and that would be enough to cover the impact of aging, population growth, and inflation in the healthcare system. If we simply commit to maintaining healthcare spending at the same level of GDP, we have enough to cover all of that and still have some room left over for improvements to the healthcare system.
Friends of Medicare 醫療保健之友嘅運動，向公眾推廣公營醫療保健制度嘅好處。謝偉雲報導。
Today, the BC Health Coalition, along with the Canadian Doctors for Medicare, Oxfam Canada, the Canadian Centre for Policy Alternatives, are proud to announce the launch of our Friends of Medicare campaign.
It's in response to the enormous number of requests that we have had come into the office saying we want to be involved in doing something to protect and enhance our Medicare.
The key to all of the work we do is the promotion of the positive public solutions to our healthcare challenges, focusing on P3s, private clinics, home support, and long-term care.
People today to sign the banner to support public health care. We're going to be delivering it to the Canadian Medical Association and saying that there is public support for our healthcare system. So if you guys want to sign the banner, then we'll be taking it to the CMA at the end of the week. When our own local privatizer of the healthcare system, Dr. Brian Day, was elected to the CMA as the president, we decided that we would have a red carpet for him and we would roll it out and say, you know, as the president of the CMA, it's important to protect our public healthcare system and showing by all of the people's signatures that there's public support for the system.
Regular Canadians have to speak about Medicare and how important it is to them, and we don't want to take our credit card for health care.
Why are we here today in Vancouver? Why are we here across the hall from the Canadian Medical Association meeting? And what's the purpose of an organization like Canadian Doctors for Medicare? Does the treatment address the disease? And in the case of private insurance and dual practice, the answer is clearly not.
Well, when I was private, I was very proud of the turnover time in the operating room. I was very proud of the lean staffing that I had in the operating room. But guess what? When I went public, the turnover time didn't change. Our staffing ratio didn't change. And in fact, we used less money because I could now tap into the economies of scale of the Winnipeg region in getting supplies. So we were cheaper. So how is it that the private sector is more efficient?
I think the imprint of the good reason why we have a publicly funded universal healthcare system is that it's kind of worked its way into the DNA of the Canadian psyche. And that's why it has been so hard for successions of right-wing governments to privatize public health care.
There are public solutions to all the healthcare challenges that we face. The information is there, the data is in, empirical evidence. We just need to allow the public to understand it better so that they can then pressure our leaders to implement those solutions.